Hi, I'm Dr. Daniela Stein. Thank you for watching. Today we're going to talk about hot flashes. I'm a medical doctor and I have a special interest in lifestyle medicine, wellness medicine, holistic medicine, functional medicine, and integrative medicine. I'm known as a menopause miracle worker. So I want to share with you what I teach my patients. One thing is hot flashes, something a lot of people seek my help with, and I can share it with you today. There's quite a lot of things that you can do about hot flashes. First of all, what is a hot flash? Hot flashes we typically see during our menopausal years, perimenopausal years. Menopause itself is really just one day in time, but you have your perimenopausal phase, which can stretch over a couple of years. And a very big proportion of women in Canada do struggle with hot flashes through the perimenopausal years. It's different for every woman. Some women have significant hot flashes. Some have it more at night because typically our hormonal level do drop at night. Our estrogen level drop and then they will have more. I should explain what a hot flash is. So a hot flash is the sudden burning in your body. It feels as if you have a furnace in your body. Your heart rate will go faster. You will start sweating. It's a vasomotor reaction. So you become red. And then you can have the significant sweat. And 15% of women have it very severe. You'll have the significant sweat where you can drench your clothes completely wet, that you have to change your clothes. And it usually lasts from about 2 minutes up to 30 minutes. Different women experience it differently. So if you want to know, do I have to get treatment for it? If your hot flashes doesn't bother you, you don't have to. You're likely watching this because it bothers you. So I would encourage you to contact your primary care provider and someone who has some experience with dealing with patients with menopause to really to understand it better, what's best in your scenario. What I typically do is I always advise lifestyle first. I'm lifestyle. Look at the clothes that you are wearing. I advise to use natural fibers rather than synthetic clothes to make sure that you layer. Especially when you sleep at night, make sure that you layer. You want your fibers, clothes to be natural, breathable fibers. You want a fan. Have your bedroom cold at night. Have a fan in your workplace. Have a fan in your bedroom. I have, at the hospital where I work, a couple of our nurses that are going through perimenopause now have on their computer screen at the nurse's desk, they have a fan that can clip to the computer screen. And when they feel a hot flash coming on, they'll go and sit there in front of the fan while the hot flash pass. So that can be very painful. I advise my patients to have ice packs ready and to put an ice pack here at the back of your neck. It helps your body to cool down quite rapidly, quite immediately. Significant difference. Next thing I advise is vagus nerve stimulation. So what a hot flash is a sympathetic response. The way you would counter that is with breathing exercises. And you can look at my other YouTube videos on breathing exercises. You can have a look. There's a blog on my website. It's wellnessmdhealth.com. I'm very pro breathing exercises. During a hot flash, you can do it to help lower your heart rate, to help you get through this hot flash smoother. But we've done quite a big study where we look at people who do this breath work twice a day for 5 minutes when you wake up in the morning, wake up at night, do breathing exercises, and you can test it for yourself. You can write down how many hot flashes you get a day. Some of my patients get more than 10 a day, every day. Write down how many hot flashes you get, how many at night, because at night it's a significant problem. It impairs your quality of sleep. You're awake, you get this cortisol rush, you're awake after. Write down how many you get, and then after you started doing breathing exercises, 5 minutes every morning, 5 minutes every night, you will notice a decrease in the intensity, duration, and frequency of your hot flashes. So really focus on your breathing, focus on your mindfulness. What mindfulness helps with is it helps you to be more calm, more intentional, more in the moment. It reduces stress. It helps you when you do get a hot flash to know how much it bothers you and how much it causes anxiety because of perception from being embarrassed from other people seeing that you're becoming all red and drenched in your clothes. And I'm really doing work to empower women to not be embarrassed about our hot flashes. It's such part of our aging, of coming through menopause into this next phase of our life. It's going through menopause is such a phase which needs to be celebrated, but I realize that people don't enjoy hot flashes. Nothing to be celebrating about a hot flash. So we can do things about it. Lifestyle number 1. If people want to take medication, and most people contact me as a medical doctor saying, but as a holistic doctor, which herbs are safe, botanicals, which are safe, which can they use specifically regarding sleeping. So one I like to give for sleeping is valerian root. I often give it with melatonin. Typically during menopause, your melatonin levels will be a bit lower. So we can improve your sleep quality with a melatonin supplement, valerian root. It's good if it's maybe with lemon balm and hops. Then Siberian rhubarb is definitely one we use with great success. Black cohosh or chasteberry. For acupuncture, it's very helpful for some people. And then when you want to ask about aromatherapy, what I like to advise is sage and lavender. You can, if you have a diffuser, you can put those drops in, sage and lavender. If you don't, you can just take a cup of very warm water and put the drops in next to your bedside. What I like to advise is to take a bath with those before bedtime. It really helps to relax your body, improves your quality of sleep. Thank you for watching. Let me know. Please send in the comments if you have any questions, anything I can do to improve your quality of life, to help you transition through menopause easier. I would love to hear from you. You can have a look on my website. It's wellnessmdhealth.com. Please like and subscribe this. And follow me on social, connect with me, whichever social channel you're on, I'm on there. Connect with me. I would love to hear from you. All the best. Take care.